Tony Evers and DHS Secretary-Designee Andrea Palm. Also available to answer your questions are Dr. Ryan Westergaard, the Chief Medical Officer for the DHS Bureau of Communicable Diseases, and Ryan Nilsestoon, the Chief Legal Counsel in the Office of the Governor. We'll begin the briefing with remarks from Governor Tony Evers.
Good afternoon, and thanks for joining us today. The COVID-19 pandemic has affected Wisconsinites in every corner of our state, from the small business owners in Ashland to the students in Milwaukee, and every family, worker, and individual in between. The impacts have been tragic and widespread. One significant area of impact has been the workers across our state who have had to apply for unemployment, some of them for the first time ever. As of Friday, the Department of Workforce Development, or DWD, had processed an unprecedented number of claims, with 7.4 million weekly claims since March 15th, paying more than 536,000 claimants over the past 6 months. That said, there's still about 8% of claims still in process, and that 8% represents folks who are depending on these critical funds to take care of themselves and their families. That's why yesterday we are excited to announce a new partnership between the DWD and Google Cloud. Google Cloud will be assisting the department in unemployment insurance claims processing by expediting the review of UI and pandemic unemployment assistance claims, ensuring all eligible unemployment claims in Wisconsin are paid as quickly as possible. In addition to working to improve our unemployment claims process, today we also provided an update on where we have invested our federal CARES Act funding to most directly help Wisconsinites and our pandemic response efforts. These funds have been allocated across public health, emergency response efforts, and economic stabilization, including initiatives for Wisconsin residents, businesses, and communities such as the Wisconsin Rental Assistance Program, We're All In Small Business Grant Program, and in providing direct aids to more than 15,000 farmers. As of October 9th, nearly $1.87 billion in our CRF funds have been allocated to support our virus mitigation efforts like testing and contact tracing, and programs to support families, farmers, and small businesses during these challenging times. We have around $120 million in CRF set aside so that we can use it to support our state's response where needed, especially in the event federal stimulus negotiations fail before the end of the year. But as we said before, our state, our businesses, and our communities won't be able to bounce back until two major things happen. First, we need additional federal support. The fact of the matter is that these funds expire December 31st. And one package passed months ago is just not enough for our communities, our workers, our business owners, and Wisconsin families who continue to struggle to make ends meet as this pandemic wears on with no end in sight. And secondly, we have to double down on the public health measures that we know will work and kick this pandemic to the curb, reducing community spread so businesses can operate safely and consumers can visit without fear. I continue to urge President Trump and Congress to act quickly to provide more support and resources for budget stabilization so that we can make sure we have the support we need to continue fighting this virus and be in a good place for our next year budget. Yesterday, I was encouraged when the Circuit Court denied the request for a temporary injunction on our emergency order limiting public gatherings to 25% capacity. This ruling is critically important and will help us prevent the spread of this virus by restoring the limits on public gatherings. And folks, we know that gatherings are exactly what we need to be avoiding at this time. Large and small, we know that they can turn one positive test into 10 positive tests in the blink of an eye. We want to see our small businesses succeed, our favorite restaurants and bars thriving again, but that won't happen overnight, and it certainly won't happen until everybody starts taking this pandemic seriously. I continue to call on Republican legislators and their allies to rise to the occasion to put public health and safety above politics and be clear with their intentions. It is now 188 days since the legislature last met, and things aren't getting any easier or any better. So as I did last week, I'm again encouraging Wisconsinites to contact their state legislators. Ask them if they support our state's public health emergency, whether they support requiring face coverings in public places like 72% of Wisconsinites, and whether they believe they should come in for a vote in advance of the November election. I know I sound like a broken record these days, so I thought I'd close the day by highlighting the words of some folks at Aspirus Wausau Hospital, whose stories were shared earlier this week. Here's what they had to say. Melissa, a registered nurse working in the COVID-19 unit, said this: I urge you, as the public, to wear your mask, stay home, wash your hands, and social distance. It's real world, and it's here, and we as individuals can help prevent it, so please help us save lives. And David, who has worked as a registered nurse for 20 years, he said this: I think if someone could spend 15 minutes with me on any given day, they would be taking every precaution to keep themselves and their loved ones safe. It's not just about you, it's about the people you care about as well. End quote. So once again, stay home, Wisconsin, and stay away from gatherings of people outside of your immediate household. Wear a mask whenever you have to go out, and do what you can do to help Melissa and David do their important work and save lives. That's what Kathy and I are going to do, and we hope everybody joins us. With that, I will now turn things over to Secretary-Designee Andrea Palm for her update. Andrea?
Thanks, Governor. Good afternoon, everyone, and thanks for joining us again today. Today I'll start with our numbers, because I do want to continue to underscore the serious situation that we're in here in Wisconsin. Our total cases now stand at 178,482. Today we are reporting 4,591 new confirmed cases of COVID-19. This count reflects some of the backlog in positive cases that accumulated as the Wisconsin Electronic Disease Surveillance System underwent a routine upgrade and enhancement over the weekend. As health departments work through importing these cases, our historical data and case numbers may be higher over the next few days. For a more accurate representation of COVID-19 in Wisconsin over the course of this upgrade, we continue to recommend that you look at our 7-day rolling averages. Our 7-day average of new daily cases stands at 3,287. 1 month ago, our 7-day average was 1,720, and 2 months ago, it was 747. 43% of our total cases here in Wisconsin have come in the last month. 62% within the past 2 months. Our total deaths have now reached 1,633, which means 33 more Wisconsinites have lost their lives to COVID-19 since our last update. COVID-19 is spreading in every community across our state. In recent weeks, we've asked you to stay home and to wear a mask if you go out, because it was safe to assume that the virus is everywhere in Wisconsin. And you'll remember back in March and April, we all stayed home to flatten the curve and protect our frontline healthcare workers and hospitals. It's important to understand that we're in a much worse place now than we were in March and April. So now is the time for all of us to double down and do our part. Please stay home. Get groceries, and if your work takes you out of your home, make sure you wear your mask. Limit your contact with people that you don't live with. I know it's tiring, but we're in a crisis, and this is what we have to do. Our case numbers are rising. This virus is claiming the lives of more of our friends and our neighbors, and our hospitals are stretched too thin. This isn't sustainable, and it's going to get worse. Our case count has climbed far higher and more rapidly in recent weeks, and we know that means there will be even more Wisconsinites needing hospital care as a result. It's up to us to make this better. We can each take action that adds up to make a difference. We know what we need to do. Stay home, wear a mask, keep 6 feet apart, wash your hands, and if you have symptoms or have been exposed to COVID-19, get a test. Quarantine while you wait for your results. And call anyone you've been in contact with to tell them to get tested and to quarantine as well. And get a flu shot to help preserve our hospital capacity. Stay connected with friends and family over the phone, via video call, or even a care package in the mail. And encourage them to stay home and wear a mask too. Maybe hearing it from you will make the difference. I know this isn't easy, and it will take time before we see the results of our actions, but we can stop the spread and save lives. Thank you.
Thank you, and we'll now take your questions. A reminder to maintain audio quality, to please keep phones on mute until it's time to ask your question. And we'll begin this afternoon with Isabel Lawrence from NBC 15 in Madison. Isabel?
Hi, Governor Evers. This question is for you just to start off. There's been some buzz on social media about a group collecting signatures for a recall, someone in the group claiming they have the needed amount of signatures now. We just wanted to get your thoughts on these efforts. Do you anticipate the petition moving forward, and do you think this is warranted?
Well, I'll tell you what I spend my time staying awake at night is thinking about people dying of COVID-19. This is not a high priority for me to be thinking about. There's lots of other things that are more important to me than whether or not there's a recall. And so my request to people is wear a mask, make sure that you're socially distanced from people, stay at home as much as possible, and you can save lives.
Thank you, Isabel. Now to Victor Jacobo from CBS 58 in Milwaukee. Victor.
Thank you again for taking this call. We have kind of two holidays coming up, obviously with Halloween as well as Thanksgiving, which is, as you pointed out, one of those moments where those small gatherings happen. We're about a month away from that. How do you recommend to people as they begin to start planning that? What is the safest way to hold a Thanksgiving or a Halloween celebration, or how should they proceed as they start making plans with that? Thank you.
Mm-hmm. Yeah, thanks, Victor. I think because folks are certainly looking to plan ahead for the Thanksgiving holiday, I think folks need to be very seriously thinking about keeping their Thanksgiving dinners to their immediate family. As we have seen with small gatherings, with larger gatherings, they are a source of spread of this disease. We know that as more folks are asymptomatically infected and potentially able to spread the disease, that we are spreading it in ways we don't even know that it's happening. And so the best way to keep ourselves safe is to limit our interactions as much as possible, and that means to limit them to the immediate household that you live with, your immediate family. And so I would encourage folks to start thinking about creative ways to share the holiday virtually and in other ways that don't require gatherings of more than the folks who you reside with.
Thank you, Victor. Now to Evan Peterson from Fox 6 in Milwaukee. Evan? Evan Peterson from Fox 6. Are you there, Evan? And a reminder, star 6 to mute and unmute your phones.
I'm sorry, can you hear me?
Yes, we can.
Okay, my apologies. I thought I hit the buttons there. My question's for Secretary Palm. Looking at the numbers, and we hear that this virus is continuing to be on the rise, when do we think this is going to peak here in Wisconsin? And what should people do to prepare for something like that? Thank you.
Yeah. So, Evan, that is entirely within our control, and we peak and we crest over the hill and start going back down the other side, pending our getting together and as a community, as a state, doing the things we need to do to stop the spread. Because right, when you think about the incubation period, you need to do all of these mitigations in a concerted way. Then you've got that lag between when that last round of infections happened, right before you really were earnestly working to do everything that was necessary on the mitigation front. Then you crest, and then you start to see the decline. And so when we do that together will dictate when we hit the top of the hill and start to see our cases go in the right direction again. And so, as we have said continuously here, we really need to do and take seriously the actions that are necessary to stop transmission, which are to stay home as much as possible, to limit gatherings, to socially distance in a really vigilant way, to wear your mask, to do the good hand hygiene and other public health measures that are necessary to stop the spread.
Thank you, Evan. Now to Mary Jo Ola from TMJ4 in Milwaukee. Mary Jo?
Hi, can you hear me?
Mm-hmm.
Okay. This question, I think, would be for Secretary Palm. Unfortunately, over the last couple of weeks, I think we've first heard you mention that we're in a worse place now than we were back in March and April, and we still continue to see some record-breaking days of positive COVID-19 cases. So what, if anything, whether it's other strategies or tangible plans, do you guys have in place to try and drive that message home, since it seems like we're still seeing those growing numbers?
Yeah, Mary Jo, I think it's really important for folks to understand the situation that we're in and the lagging indicator that hospitalizations and deaths are as a result of, to your point, the rise in cases over the last month or so. And it makes, right, the goal is not to get to a place where your hospitals are as stressed as ours are, but it is an indicator that we have really widespread community transmission and that we need to take this seriously. We need to commit together to doing the things that are necessary to stop the spread. There aren't new tools. I mean, it's the same things that we've known need to happen and that other states and other countries have proven work that we need to deploy here in the state of Wisconsin to get us right, back on the right track. And those are limiting your social interactions to your family, stay home as much as possible, wear a mask. The evidence is very clear about the effectiveness of mask wearing, but we all need to do this together. These mitigation strategies are most effective when they are universally or near universally utilized, and so we all need, like we did in March and April, we all need to do this together to get us back on the right track and moving in the right direction.
Thank you, Mary Jo. Now to Rob Sussman from WTAQ Radio in Green Bay. Rob?
Yeah, thanks for taking my question. I suppose my question might be best answered by Mr. Nilsson. There are a lot of people in this state who have applied for unemployment and went months without getting any sort of answer as to whether or not they managed to qualify or had their claim processed, and then have since returned back to work. My question is, are those people, when they do ultimately go through the system, are they going to be made whole by the state? Thank you.
Yes.
Thank you, Rob. Now to Stephanie Hoff from West Politics. Stephanie?
Hello, and thanks for taking my call. My question is, I'm looking at that CARES Act money chart that was put out in a release today. It looks like a lot of money was moved out of the surge fund. And my question is for the governor, why did you do that? Was it not needed? And don't you need that money now?
Yes. The surge fund was, we made a change in that is because we did not have while we built out the alternative care facility for some time, we obviously didn't need it until this point in time. And I think if you see in the bottom of someplace on that chart, I don't have it in front of me right now, but we included money in it to take care of what we're doing today. So it was a long lag of use of that facility, and so we decided to lower that budget, but then we put money back in order to serve the people that may need it now.
Thank you, Stephanie. Now to David Wahlberg from the Wisconsin State Journal. David.
Yes, thank you. We're still seeing record hospitalizations from COVID-19, and Secretary Palm, you just talked about hospitals being stretched too thin and being stressed. How come nobody's using the alternate care facility?
Yeah, as we've talked about many times, David, the alternative care facility really is our ultimate insurance policy, and we want to make sure that it's there should our hospitals need it. What you saw folks doing among our hospital systems and within those systems during the early months of this pandemic was the surge planning and capacity building that they needed to do in anticipation of something like this. And so what you're seeing them do right now is deploy those plans. They are sharing assets and resources and beds within systems, among local hospitals, even more broadly than that. And those are the kinds of things that they will deploy in anticipation and before they would need to call on us and the alternate care facility to be available for them. I think the urgent call we heard from them in anticipation of opening the alternate care facility was that they needed us to open it. They wanted us to open it. We wanted it to be ready for them should they need it. And so we have stood it up. We are ready to take patients. But it's a very dynamic and fluid situation, right? The active management of patients on a daily basis in the hospital is an active and fluid thing outside of a pandemic. And now you layer the pandemic on top of it. And it changes day to day, and they are managing it very actively. We are in very close contact with them and want the alternate care facility, which it is, available to them should they need us.
Thank you, David. Now to Mason Dowling from WAOW-TV in Wausau. Mason.
Hi, this question is for Secretary Palm. We've been hearing reports, and actually Oneida County has just reported that they are basically completely out of flu shots, and other counties in the central Wisconsin area are noting that they are running low. Is there anything coming from DHS as far as getting more supplies in soon?
Yeah, so I would say a couple of things. One, we have to date seen just about 280,000 more people in the state of Wisconsin get a flu shot at this time this year compared to last year. So I would express a lot of gratitude to folks who are hearing and understanding the importance of getting a flu shot this year to help protect our hospital capacity and stay healthy in ways that will allow us to better manage COVID moving forward. I think what you're seeing in Wisconsin and across the country is that there will be ample supply of flu vaccine, but we are seeing some delay in delivery. And so what I would encourage folks to do is to go to the flu finder on our website. You may just have to be a little bit more creative while supplies are still making their way to providers to find a vaccine close to you while we await and get through some of the delays in delivery that we're seeing. But we don't anticipate an actual shortage of flu shots. It is about the time of delivery as opposed to there being enough flu shots that will arrive in the state of Wisconsin. So take a look at the Flu Finder website, find a location close to you that has supply, and it may not be it may not be the place you got it last year, but I would encourage people to continue to actively seek out flu shots and keep our numbers going in the same direction with more and more people getting vaccinated.
Thank you, Mason. Now to Nick Penzenstadler from USA Today. Nick?
Thank you. I'm wondering about the alternate care facility, if you have any concern that hospitals would try to dissuade a patient from transferring there to maintain those patient dollars, and if you would like to see more low acuity patients transferred there.
So, these are, before a patient will be transferred or would be transferred to the alternate care facility, that patient's care team would be in active conversations with them about the possibility of that transfer. And so those conversations are happening at the bedside about what is best for that patient, what they could expect at the alternate care facility, the kinds of things that the alternate care facility is able to provide versus the hospital, making sure they're an appropriate candidate for transfer, and then engaging with Deb Standridge and her team to make those final decisions. And so those kinds of conversations are much more actively happening in the hospital that is looking to transfer, as opposed to with the alternate care facility. We are using CARES Act dollars to fund the facility and the care that is received there, so that care has no cost to the patient. I think that's an important clarification coming out of your question. But the decision about whether the patient is interested and willing to come to the alternate care facility is at the discretion of the patient and their physician to make that decision before they engage with the alternate care facility.
Thank you, Nick. Now to Sean Kirkby from Wisconsin Health News. Sean.
Hi, thank you for holding this. Last week, DHS officials said the Army Corps of Engineers was re-looking at plans for additional alternate care facilities in the state. Are you planning to move forward with any? And if so, where would they be located? Thank you.
Yeah, so Sean, we are re-looking at sites and plans and conversations that we had earlier in the year. Should we need to pursue any of those, so we would certainly be ready should we need to. But obviously we have yet to see a patient in the alternate care facility and are in close contact with hospitals about the use of the facility and where else we might need to be considering capacity across the state. And so we want to make sure we're ready, and we will get ready should we need to. But at this point, we don't have plans or think it's necessary to begin building or construction on a second alternate care facility.
Thank you, Sean. Now to Danny Maxwell from WKOW-TV in Madison. Danny. Danny Maxwell from WKOW.
Hi, this is Matt Cash, WKW. I'm in for Danny on the call. Thanks for holding this today. This question's for the governor. This weekend, obviously, on Friday night, the Badgers play their first home game. We've already seen some photos on social media from previous football Sundays of Packer fans maybe gathering at certain establishments in the state. As we look for another night and a weekend of another day of football, what kind of message do you say to people that might be tempted to get together to watch these games, but as we still deal with this pandemic into the winter months, what should people be thinking about?
They should be thinking about watching the game at home alone, frankly, or with the people that they're living in their residence. The University of Wisconsin-Madison has taken the issue of game day very seriously. They've closed down, or they will close down all of their parking lots, so there will be no tailgating in any of those. I anticipate that there will be making sure that the folks that are in bars and restaurants in downtown are absolutely physically distant from each other and meeting the 25% that we have laid out as far as a limit of people. But, I get it. I was a student here several years ago. It wasn't just yesterday. And I understand the issue of the fun of game day, but frankly, I believe our students have understood the seriousness of this disease. Campuses are masked up pretty darn well, and so I think it's going to be okay. If there's obvious large parties, I believe that the university will be active in closing those up as best they can. But at the end of the day, watching the game, it can be just as fun watching it with the small number of people that you're living with that you know are COVID-free. And, if we continue to make excuses for not doing this, we will have more deaths, we will have more people with COVID-19, and frankly, we will have a lot less economic activity in the state of Wisconsin. This is a critical time, folks. I know fun is fun, and I'd like to have as much fun as anybody else. But if we really want us to return to a place where we can be engaging the economy of this state, we have to be very careful with what we do in the next several weeks, and that includes game day.
Thank you, Matt. Now to Ben Krumholtz from Fox 11 in Green Bay. Ben.
Hi, thank you for the opportunity again. It seems like our numbers have been surging for about a month or two, and it's hard to see any sign that people have changed their behavior and are doubling down on the safety protocols to stop the surge. Have you guys seen any signs for optimism that people are taking this seriously and changing their behavior?
Well, I'll try that. First of all, as I said, even if people haven't, it's probably a good time to start, because if we aren't safe in our expectations for our health, our own health, we're not going to be good consumers, and our economy is going to tank. And nobody wants that. And so I have heard good stories that the mask order that we have has made a difference in our schools, and whether that's and other places in the state. I've had lots of people contact me and said, well, don't necessarily agree with it, but I agree with the fact that we need to do this at this point in time. So, do I have any quantitative data at my fingertips? No, but I do see that people are wearing masks more than ever before. And I also see that the percentages of people who support this on polls is good, but we still have 20 to 30% of the population that isn't with us. And that's why I'm really hopeful that we can get our Republican friends active in this effort to get people to wear masks and to socially distance. And I encourage them to take a role in encouraging their own friends and neighbors to do the same.
Thank you, Ben. Now to Jeff Dutta from Spectrum News, Wisconsin. Jeff?
Hi, thank you for holding this call. Governor Evers, you talked about needing more federal funding to respond to this. If there isn't more federal funding past this year, are there any programs or services that would end specifically, and how would it impact the state's ability to treat and respond to and test coronavirus patients?
Yeah, and we'd have to make some very, very, very difficult decisions in next budget and in the next biennium. Essentially, any money for schools is at risk. Funding for our health care outside of COVID-19 is at risk. There's a lot of things at risk that as part of our state's budgets and our state's efforts. COVID-19 we will have to pay for it, but it will be a significant issue for our budget. This is a nationwide thing. There's no reason why the federal government cannot step in. It doesn't look like they're going to do it before the election. Everything seems to be delayed until after that, unfortunately. But at the end of the day, you'll see people in Wisconsin will see a dramatic decrease in the services that the state provides and resources that directly go to individuals and schools and municipalities. We have to take care of COVID-19 first. And if the federal government isn't going to do their job, we will have to make the hard choices in Wisconsin.
Thank you, Jeff. Now to Mayan Silver from Milwaukee Public Radio. Mayan?
Hi, good afternoon. This is for Governor Evers and Secretary Palm. So some of the surrounding Midwestern states near us have about 1/4 to 1/2 the per capita COVID rate of Wisconsin. In your own words, in your own mind, what are the reasons that COVID is surging so badly in this state?
As compared to other states, those governors haven't been prevented from doing what they think is the right thing, whether it's mask orders or other mitigating factors. The ability to mitigate was made very difficult with the Supreme Court decision last May. And no other governor except for Governor Whitmer, who just had her orders taken away from her just recently, several months later. That happened in Wisconsin in May. And that, to me, that was a huge mistake on the part of the Supreme Court, and it has made it more difficult for this state to move forward.
Thank you, Mayan. Now to Will Cushman from WisContext. Will.
Hi, Secretary Palm. I am wondering if you may be able to help contextualize a little bit some of the numbers that have come out since the system upgrade over the weekend. It looked like there is a really high number of negative test results reported, much higher, I guess, than usual. And I'm wondering, I know that the system upgrades included, or it's my understanding that they included the ability to kind of more quickly process negative test results. And I'm wondering if that might be involved, or if there is just like a lot more testing going on in the last several days, or any other factors that may be involved in those elevated numbers. Thank you.
Yeah, Will, you will recall that sometime in the last several months, so the issue with the negative results is that they have to be pulled, or before the upgrade, they had to be pulled manually into the system. And so that we would not see issues with our positivity rates and with the data, a workaround so that those numbers would show up in our data in a way that didn't skew the numbers. And so what you're seeing now with the automated matching and pulling of those negatives is the reconciliation of the manual process with the automated process. So in our positivity charts and other places, those manual workarounds account for those negative test results, but the upgrade is now caught up with, is catching up with and has caught up with the manual workaround that we had in place to keep the numbers from being skewed in our reporting on a regular basis. So if you look at the the charts on our summary page, for example, those additional negatives are not changing the way those charts are looking or the way they're reading because of the workaround that we had in place to make sure we were showing as accurately as possible that information. So those negative numbers are essentially catching up with the manual process that we had put in place when this issue came to our attention earlier this spring, or this summer, I guess, is more accurate.
Thank you, Will. Now to Katie Anderson from WBAY TV in Green Bay. Katie? Katie Anderson? Okay, we'll move on then to Jessica Van Egren from Up North News. Jessica.
Yes, hello. I have a question about the drug remdesivir. I was wondering if anyone knew how widely it's being used in the state of Wisconsin and if there was any sort of, I guess, special requirements or permitting necessary for the alternate care facility to administer that drug, given that it's my understanding that it's something that patients need to receive over a 5-day period. Thanks.
So I'll take the second part first, Jessica, then I'll let Dr. Westergaard weigh in. So we did request of the Food and Drug Administration a clarification on the provision of remdesivir in an alternate care facility and received that on Friday so that we are able at the alternate care facility to continue to provide patients who are on remdesivir the remaining doses. To your point, if they are prescribed a 5-day course of treatment and they need to and they're coming to the alternate care facility and they still have 2 days left to take of their remdesivir, we will now be able to do that with the clarification we've received from the FDA. So that is not a barrier for patients who may be eligible to be served at the alternate care facility. But I'll let Dr. Westergaard talk more broadly about that.
Sure. So. With regard to the number of patients receiving it, unfortunately, I don't have the answer to that with precision. For the first several months after it received emergency use authorization, it was allocated to states from the federal government, and we were distributing it. That program has ended, so now it's available on the market, and hospitals can procure it through the regular mechanisms that they acquire pharmaceuticals. So we don't have access to that information in the way that we used to, but we may be able to answer the question, and I'd be happy to follow up offline if we want to communicate by email.
Thank you, Jessica. Now to Todd Richmond from the Associated Press. Todd?
Hi, can you hear me? Governor, any thoughts about early voting starting today?
Yeah, I think it's it's great that we have this opportunity in the state of Wisconsin. It's one of those things that I believe makes voting easier, and that's exactly what we should be all about. I was a bit disappointed in the federal court case a few months ago now, I believe, where the 4 weeks was scaled back to 2 by the federal court. But that said, I think Wisconsinites love to have the options, and we're voting in great numbers as absentee, and I think that we'll be voting in large numbers for in-person voting in all across the state. So it's an exciting time. The clerks of this state are heroes. They're doing great work, making sure that they're doing everything they can to abide by the law, but also make sure that people are safe and healthy while they are voting. And it should be a good election, and the early voting is a major part of it.
Thank you, Todd. Now to Jonathan Neiser from NBC 26. Jonathan.
Yes, thanks for taking the call today. A local health department recently provided a link to a DHS handout that references an online tool for those who are COVID-19 positive and wish to notify close contacts anonymously by text or email. Can someone talk a bit more about this, and with the strain on contact tracing, if there's any indication that suggests this tool can make a difference?
So I'll say a few things, and then Dr. Westergaard can, I'm sure, dig into the handout specifically. So we are, as we have talked about, we are absolutely seeing a strain on the public health infrastructure in the state of Wisconsin, as many other states across the country are, and it is impacting their ability to do contact tracing in a way that that is as efficient and timely as we would want it to be to really help stop the spread. We have put in place, as a result, some guidance around ways to make the process more efficient, things like shortened questionnaire form, the thing you mentioned, where positive cases can notify their own close contacts. So we are deploying a number of strategies, or giving local public health a variety of options to make the process more efficient, so that we can continue to get the minimum information that is necessary to continue to contact trace in a way that is helpful. But it speaks more broadly, again, to the need for all of us to do what we need to do to stop the spread, so that our local public health departments and contact tracers have the bandwidth that they need to do contact tracing in the way it was designed to be done. And as we continue to say, that is, stay home as much as possible, limit your contacts to those in your household, wear a mask when you go out, do the good hand hygiene, be vigilant about your social distancing, and really be conscious about the choices you're making, and make choices that are safer, while we really all work together to stop the spread. But I don't know if you want to talk specifically, Dr. Westergaard.
Yeah, I think it's a really good question. I'm glad you brought it up, because it points to one of the really important negative consequences of the surge that we're having. We focus a lot on hospital capacity, but public health capacity, the ability to identify clusters, to notify people have been exposed, is beyond strained. To review what contact tracers are supposed to accomplish, there are two things. People who are test positive are supposed to get a phone call and an interview, so they know what they need to know and also understand where they've been and with whom they've been in contact. Then those contacts are also notified and communicated with by public health to tell them what they need to know. So right now, with where we're having 3,000 to 4,000 cases a day, the whole infrastructure, the local public health, tribal public health, and state public health who are doing this cannot keep up. So in many areas, that second piece, the notifying the exposed contacts, isn't able to be done in a timely fashion. So we're relying on other strategies, like coaching people who test positive to notify their contacts. That's not the way it's supposed to work. We want to be able to communicate everyone who's exposed so they know how to stay safe. We're not able to do that now, so we're trying to do the best we can under the circumstances. But the implication of that for community spread is that you can't rely on getting a phone call from someone to tell you that you've been exposed. You may be exposed out in the community and not know it. And that really is the point what we're trying to get across, which is that we need to keep gathering small, because you don't know where the virus is. You don't know who's been exposed and who's tested positive. And now we're at a point where public health is so strained that you can't count on us to tell you, which is really, really not where we want to be. We have really highly trained public health professionals who do this work very, very well, and we don't have enough of them right now. So in addition to protecting hospital capacity, protecting public health capacity to do this, to keep our communities safe, is really important.
Thank you, Jonathan. Now to Melanie Conklin from Wisconsin Examiner. Melanie. And Melanie Conklin.
Good afternoon. This question is for the governor, although others can feel free to chime in as well. Governor, what is your reaction to the financial costs for taxpayers for the private attorneys that are fighting against public health measures that you and DHS support?
Yeah, it is difficult to swallow, frankly. The amount of money that goes into fighting around things that, frankly, shouldn't be controversial, but are is disappointing. That money could be better used to hire more contact tracers and others to put out PR campaigns to all people in the state as it relates to making sure they do the things that they need to do to mitigate this effort. So a lot of time and energy and frankly money goes into fighting court cases that have occurred every time we've made a step forward. So it's frustrating, but we'll continue to do it we believe we're in the right position, and we'll continue to fight for the people of Wisconsin to make sure that they are healthy and that we can have an economy that works for everybody.
Thank you, Melanie. Now to Chris Mooney from the Washington Post. Chris. And a reminder, *6 to unmute your phone. Chris Mooney from the Washington Post. Okay, we'll move on then to Hope Kerwin from Wisconsin Public Radio. Hope.
Hi, this is Rich Kramer. I'm stepping in for Hope Kerwin. I'm wondering if any of you can speak about how some of the University of Wisconsin system campuses located in real hotspot areas in terms of virus activity right now, they're reporting case positivity rates of, in general, it's less than 10%, whereas some of the surrounding communities might be, in the 20s or higher. Wondering if you have any thoughts onto how that can be, if it's a testing situation or what. Also, UW has been using antigen testing for surveillance. They're kind of expanding that off campus now, and I'm just wondering if that's ever been considered as an option for testing state residents outside of the universities.
I can take both of those. I think the question earlier about what's going well, this is what I would have said is that we learned a fast and hard lesson at the UW-Madison campus of how explosively the virus can spread in dormitory settings. So close contact, people living indoors. They had 2,000 cases within a couple of weeks of campus. So one of the most encouraging things I think that we've seen on the epidemiology side is how quickly we were able to turn that corner. And now they post, similar to the state and other campuses, they post their daily numbers, and they have an eliminated transmission, but they have much lower case numbers, 10 to 20 cases per day, and they're testing large numbers of people. They're still doing thousands of tests per day. So what all of the UW system campuses have in common is that they are doing a large number of testing, and as the governor alluded to, they have bought into wearing masks by and large. There's been a sense, what we've heard from campus leaders, a sense of shared responsibility among college students, and that has translated into lower transmission in those settings. So I think they're really doing a good job, and campus leaders and the students themselves deserve a lot of credit. Regarding the question on antigen testing, so antigen tests are increasingly available in all settings. They're FDA cleared or under emergency use authorization. The UW system purchased a large number and then are using them as sort of the mainstay of testing in the non-Madison campuses. But we're also using them in long-term care facilities, and we're getting additional shipments from the federal government to use in additional settings in healthcare and long-term care and potentially educational settings as well. So as these become more available, we will probably use them increasingly. But I think the lesson from campuses is that frequent testing, taking mask wearing seriously, and doing contact tracing has worked, and that's proof that it's worked in those settings.
Thank you, Rich. Now to Lane Kimball from News 3 Now in Madison. Lane. Again, Lane Kimball from News 3. Okay, moving on then to Maddie Heim from the Appleton Post-Crescent. Maddie.
Hi, thanks for taking this call. So just to back up a little bit to contact tracing again,
So to make tracing work perfectly, like if you could wave your magic wand and make it work perfectly here, how many tracers do you think we would need to handle what we're going through right now? And I guess, how far off are we from what we would need to have it work as it should right now?
I'll let Dr. Westergaard, but I would just say, Maddie, if I had a magic wand, I would be using it to reduce the number of daily cases, not increase the number of contact tracers. But I think Dr. Westergaard has looked at some models around.
Yeah, it's hard to know, and it keeps changing. I think in a perfect world, back when we were planning, we've talked of the sort of the smallest jurisdiction. Right now, all of our jurisdictions, all county and tribal health departments have high activity level. I think ideally the smallest jurisdiction probably needs 2 or 3 people doing this full time right now. So scaling that up across all of our jurisdictions is probably 4,000 or 5,000 people. So it doesn't. But I also hesitate to say that we need that many people, because we shouldn't need that many people. If we can control transmission, if we can break transmission chains so the number of cases and the number of contacts gets low, and both of those are important. So reducing the number of cases requires fewer people for contact tracers to contact. But if everyone keeps their circle small, we don't have large gatherings. If you limit close contact with people outside your household, the work of contact tracers gets a lot easier, because we don't have to notify large networks of people who are potentially exposed. So the number is likely to change. I don't think, we'll always take more. There'll always be a need to do this. But it's sort of like the question about when is this going to peak? Like, it's really up to us. We really have control over how many contact tracers are needed by how many people we are in contact with and how good of a job we do at controlling transmission.
The point of contact tracing is ultimately to find the source of the outbreak. And when you're talking about community transmission that is as widespread as we're seeing in the state of Wisconsin, it's hard to find the source because it's so widespread. And so this idea that we need as many contact tracers to chase the daily number of cases ignores what the point of contact tracing is, which is to help us box in the virus. And we're getting to a place where it's so widespread that chasing down the root cause and wrapping around it to stop the outbreak is less of a thing, because it is so prevalent in our communities. And so we need to do everything we can to stop the spread. Stay home. Limit your contact to your immediate family. When you do go out, wear a mask. Do the things that we're talking about, all of us together, and we'll get back to a place where we're moving in the right direction again.
Thank you, Maddie. Now to Sophie Carson from USA Today Network, Wisconsin. Sophie.
Hi. My question is about the data and the numbers. So could you describe, and I don't know if this is a little bit different now that the system has been updated, as you referenced earlier with the negative test, but could you please describe the difference between a test being processed by a lab and it being confirmed and entered into the state system, and a little bit about that timeline?
So I guess I'll say a couple of things, and if this is not hitting exactly what you're talking about, we're happy to follow up. But we have a network of labs across the state of Wisconsin who are processing tests for us once the specimen is collected, and while we have really good turnaround times here in the state of Wisconsin, some of it is about proximity to the lab, some of it is about the number of tests that a lab is doing, but we continue to see on average a 3 to 5 day processing time for tests here in the state of Wisconsin, and we're very focused on continuing continuing that kind of turnaround time so that we have good actionable public health information. I think more broadly on this issue, or the issue of reporting tests, when the system was upgraded over the weekend, on Saturday we did not report new cases. But in our daily positivity charts and other charts, you will continue to see that information populate for Saturday, that date when we didn't report anything, and that is because we report in those numbers the day it's the difference between that Saturday no cases reported into the system versus the day that test happened, which is what you're seeing in some of our other charts, which are labeled. You can tell the difference, but I think that is some of what you're seeing between the day reported and the day the test was given. And again, if I'm not understanding your question or hitting on exactly what you're asking, we're happy to follow up.
Thank you, Sophie. Now to Will Keneally from PBS Wisconsin. Will.
Hi, thank you. I was hoping you could provide quick updates on whether any National Guard members were going to be helping out municipal clerks for the election, and kind of additionally how that might change if the Supreme Court throws out the current emergency order.
Okay, that last question is a little, I'm going to have to ask Ryan to talk about that. But we're in constant consultation and conversations with the Wisconsin Elections Commission, and we will have National Guard men and women available. The exact numbers have not been determined because that number changes daily, but we will have that information in time to have our National Guards men and women on guard, as many as needed in the state. How that's impacted by the Supreme Court decision, I'm not sure it is at all.
I would be happy to answer that. So in the governor's public health emergency declaration, it did authorize the National Guard to be called to state active duty to help assist with the November 3rd election. It's similar to what was done in the spring election and what was done with the primary as well. If the Supreme Court would toss out the public health emergency, it would make things significantly more complicated in order to provide the National Guard, because it would have to be done on a municipal by municipal basis. And considering, the hundreds of municipalities we have across the state, it would make it extremely difficult to be able to provide support uniformly across the state.
Thank you, Will. Now to Steve Elbow from the Cap Times. Steve?
Hi, can you hear me?
Mm-hmm.
Okay, thanks for taking my call. I want to go back to the question about Wisconsin in comparison with other states. Other states where controls have been lax, but Wisconsin's out among the top in the rate and number of cases. I think we're contributing to the tally at about 3 times the proportion of population. What other factors can help explain why Wisconsin is faring so badly compared to other states?
So I would agree with the governor's assessment that it is about the tools in our toolbox and mitigation strategies. I do also think it is important that folks understand the seriousness that the state of Wisconsin is in, and that we all start to work together to reduce the spread. And so we do need folks, even though we're all tired of it, certainly to increase compliance, to increase the vigilance with which we're wearing our masks, with which we're adhering to social distancing, with which we are limiting our gatherings and our participation in social activities that could result in the spread of the disease. But I think, we certainly have seen from states across the country that the use of mitigation strategies is really the most effective way to reduce the spread of the disease and get them and get us back on the right track.
Yeah, and I'll just jump into, as much as we don't want to admit it, use of mitigation strategies has become a political issue, and we're in the heights of a political season, and so it has played out in a very bad way, frankly. So that's part of it. You know, I talked about the president before. He has been extremely inconsistent about his belief that this is a thing. It is a thing, and unfortunately, people that believe the president and everything he says, they will be discouraged to wear a mask and to socially distance. And that frankly just doesn't work very well.
Thanks, Steve. And our final question today belongs to Patrick Palantonio from WISN in Milwaukee. Patrick. WISN TV. Okay, then that wraps up today's media briefing. Please continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a great afternoon.